Ublatia Nunavut mute. Ublumitako Nuban Narata Hart to Nunabuiluani 7. Amatako Nuban Naraka near to Nunabuiluani 9. Nunavut Luani Katilukta Riman no York Takwa 70. Nuban Narakatut. Amatako Tamang Milukta Tabania Kalungni to Takwa 70. Ublumutikid Lugo, Taimanga Nuban Narata Lao Manakalungni 107 Nuban Naraka on near to. Takwa Nunavut mute Nuban Narata could make a Kapayo Himayo Hibud Lapami 16,419. 12,878 Kingun Lame Kapio Himayo Nuban Narata Kutimi. Ublumi Tan Nayangwan Upigu Naman Hanat Daily. Takwa Okakalua Mokani Chalangit Ama Takwa Nayangwat Atud Laring Mata, Iqaluit Lari Homata, Nunavuiluani, Nunaling Nilo, Yua, Kayakahuitu Matakwa Nunalia Lan, Nayangwaka Mata, Nayangwa Yuta, Iqaluit Lari Slutit, Matna Himatsa Mapaka, Amakoyalim Malumatakwa Nayangwa Pilarin Namata. Taimang Nuban Narata Manu Nunavuiluani, Pillar Rakimang Mata, Nuban Narami Pillar Pikina to Limitaqua, Anya to Ikayokta Marti, Takwa Nayangwa Lukta Nunavuiluani, Makana de Mat Nakimapaki, Mat Nakimapaki, how you may Pillar Rangin Nataki, Takanak to Lop, Takagaluas to the Takwa Nayangwa Pillar Nama Mata, Mat Nakimabunga. Uvabuli Nunumuti Wotakomat Natak Wotakwa, Ilamat Nareha, Takalwata Wotakwa Nayangwit, Pilarin Natamata, Matna Napahi, Takagaluas to Titakwa Nayangwa, Pilarin Nareha Tamata, Taikatu Tamata, Matna Napabun, and Makinul Lapang Luatana, Nunabum Mudu, Anigarovit, Kina Pakimatari, Taluari, Agawel Micha Taluit. I himalutit ayung inarawit at ublaluk tangin luta. Kanigilo tangin luta. Takwa malikuptigo kihanita nuban narwa kalamyona kanungun naman. Makapiyaw himang inarawin nuban narwa taray kuti makapiyaw yak to naputit. Mahiwal la pa makapiyaw lao narawit. Tuglia na kapiyaw yak to maputi. Matnaw yahid nunubun miyun. Today we are reporting 7 new cases and 9 recoveries of COVID-19. There are 70 active cases in the territory, and all are in Iqaluit. There has been 107 recoveries to date since this outbreak started. So far, 16,419 Nunavut mute have received their first dose of the Moderna vaccine, and 12,878 Nunavut mute are now fully vaccinated. It's National Nursing Week, and I can't stress enough how vital our nurses are. They keep Nunavut mute healthy and well and are the first point of contact of healthcare workers in most communities. There aren't enough words to properly show my gratitude, especially for their constant and tireless work during this pandemic. But thanks. Your efforts and dedications are the backbones of our response to COVID-19 and healthcare delivery in general. Nunavut is grateful forever. So Nunavut mute, let's show our appreciation for our nurses by thanking them, show them respect and kindness, and most of all, by continuing to follow all public health measures we have in place. Our nurses deserve a break in all this more than any of us know. They have been working tirelessly. So please mask up, wash your hands often, stay home as much as possible, keep strict social distancing, make safe, healthy, responsible choices, and get vaccinated. Thank you, Nunavut mute.
Good morning. Over the weekend, we made the difficult decision to close the Iqaluit Elders Home after a staff member tested positive for COVID-19. As a result, the majority of staff are isolating, which makes it impossible to provide safe, quality care to residents. 4 residents were sent to Embassy West in Ottawa, while 2 were sent elsewhere in the territory. One of these has returned home with family and the other to another elders facility in Nunavut. Both of these individuals will isolate for 2 weeks, and for the person who returned home, their family must also isolate.
Ula sakut pinasarusu nungwa ne ayok naktumi sumalero tahara khalawat tamatu yaw kullugu ikhalun innakuving ikanayak timi naluna taw yakhalaw tilugu nuvadyanak 19 hamninganik tay may marami sunir sa ikanayak ti anit teligya khalangata tay maawlat at siyaw jagun ne nga tanang itukut amalo ipigiyaw siyaw na jagun ne nga tatako tay kanimyon. Sitamat aulak titaw lautut Aruwamut West Embassy mut makuk aulak titaw lutik Nunavut iluani. Ilangang ikaminuti lautu ila minut ambalutako makuk kanik inakuvim mo suti Nunavut aseani iluani. Tako tamakyan teliga hamnakto makun ni pinasarusin ambalutay nang ikaminuti lautuk tay kotaan teliga hamnak mayo ilalimang ilumyo katingi.
Once staffing permits, most residents will be able to return. While the center is closed, elders who need care will be supported in other facilities, either here in the territory or in the south, depending upon their need. On Saturday, we announced that the last individual in Kinngait with active infection has recovered. With this in mind, it is safe to ease restrictions, including lifting the current travel ban in and out of the community, effective Wednesday, May 12th. Anyone returning to Kinngait from Iqaluit must continue to isolate for 14 days along with their household.
Kanayak takat sarun na si patatako uterun na lakto innain. Tana matumaningan ni innakuvik tay ko innay pigiyaw gayali kayok taw hatam na lakto asingin ni innakuvik may tamani Nunavut ubalokalunani. Ikayok taw gayakak tigini malilugin. Natsi wayalam namin naluna sila tugo kingulyap pa kingam ni taan na nuvadyo na kalaw to kanoy gunir ni nganing. Taman na isa magilugot ako ulugan na tumigunir to kasuyaw gunam ni malitaw gali ilagi yaw lunitaan na tikibiw gunam ni nga aulabiw gunam ni nga Kinngait. Pigyalo ni pingat sa May 12 kinatuin na kingam no tekto ikalun next suli anit taili gaya kayak to ulo ni 14 ni ilo may katilimangilo.
Other measures in the community include masks remain mandatory. Indoor private gatherings are at 5 people plus household members. Indoor gatherings for public community spaces, including arenas, may allow 50 people or 50% of the facility's capacity, whichever is less. Outdoor gatherings of up to 50 people with physical distancing are permitted. Solo workouts with masks are allowed anywhere fitness sessions are held. The health center may permit a maximum of 2 visitors from immediate family per patient. Masks are mandatory for visitors, and children aged 2 to 4 are encouraged to wear masks. And schools may move into stage 3 of the Department of Education plan, and daycares may open.
This is in Kinngait. Tingita ko asing imalitaw gali kingam ni suli ukwa ngayon. Suli matuwa sa maghatarali miligak si maluti asiago behangitukut. Ilo ani katinga hataw nakto tali maugunak sa yut. Ilo may katigi kakan ni ngagut. Ilo ani balo kikutuin na upagangin ni ilagi yaw lutan ni kitubi may 50 ugunak sa yut. Ubalo abang itatat suma ilo tuwa inukakunak ng itanali ato ina katsinaw nak sa malitaw luni. Tamakwelo tut serbi 25 ugunak sa yut ubalo abakiluli kita ko inuhabigi ugunak tangita. Sila may anikatarun ng na to 50 ulutik inukatigit kanigilo at tayo katalutik. Tako ikailisap tut miligas sa maluti tayo may ugunak tut tayo may ikailisap bingin ni ikailisap na ito akata. Ana bimita ko makunik upat tayo hatarun ng na ito pulata harun ng luti ilagi yaw yunot at unit si mayunot ana belar si mayunot. Miligas si may nareli asya gubihang ito kupulari aktot ang malusurusid ukiuli 2 4 tayo miligas si makatakuyaw gaswar na kaya kamiyo. Ilidner beeping ayoan ni nalunay ko tanganur nertut ilidner naliriyek ko parnautingi malilugit ang malupay revi matayakon naksiyoy.
As we continue to urge people to follow public health measures, I would like to remind people to be mindful of habits that present a risk for acquiring COVID-19. Sharing things like cigarettes increases the risk of catching and spreading COVID-19. Being outside, gathering in groups that are not 6 feet apart, not wearing masks, these are activities that put the entire group at risk from COVID-19. We must all take the time to think about our actions so that we can protect ourselves and those around us. Thank you.
Sulayaw tuiga kung akikulimanik malit sa katakulugan na hamnang ituloy na mumalitaw gali. Iqaitit sigo mayong akikutuin nam ni tayo tamakko kanuiliro sige jabulo kaya naktumigo tayo kung naktunubat jo anak 19 tarom na nakmut. Sula mi kakatam na mo sigalian ni tayo maulo kaya naktumigo na nga siyang maktigat tayo kung nam ni nga ninubat jo anak 19. Sila may itilugi tamakko akatinga kata to akata 6 ni isigam ni unga sige ingito akata matuas mang ito akata tamakko tagkakikuliman ulo kaya naktumilak titsigo tayo kung nakusang mabiyo yun nam ningin ni nubat jo anak 19 mi. Isa masasiw tuwin na katara hatugo kanuiliro na ang nitinimaan na yok tayo man sa pumikatigit sa nakata maloino katitinig. Kuyan namin.
Ken Driscoll, EPTN National News. Dr. Patterson, you talked about 6 residents of the elders' home here in Iqaluit. Was that all of the residents of the elders' home, or are there still some elders in the residence?
Luta, tanak just to EPTN kung niluta Patterson in na 6 mo nakakaw yatita ko awlak titaw yuminin. Sulitay ka ni ame ako tahakha.
That's all of the residents who were in the facility.
Nagkata ko ilo natitay ka ni inako vimilaw to.
Dr. Patterson, in your opening remarks there, you described it as a difficult decision to essentially evacuate the elders' home. There must have been other options available to you. Maybe you could have put them out at the Oxford Night Hotel. Maybe there's something else. I'm wondering, why did sort of walk us through the decision-making process and why you thought evacuation was the best move?
Taman na yung natusaw, ila yung naktuminiw ni kalaw kavi sa maliro tayo ga suwatin lugo tako ani tayo ga hamningin ni asingin ni nalira ko sa kalaw tusaw galo ako si surla sa nito yung may ginok tayo luti suma ila nalo na yeke na kano tako sa maliro tayo law mga ta.
The reports that we received is that there because of the number of staff in isolation, there weren't enough staff left to provide safe and appropriate care for the next 2 weeks. So there was no other option other than moving them outside of Iqaluit and into more appropriate facilities for most of them.
Tako tu sa lawat tigo tako ikanayak di ami suyani taydiga hakti tawlam ningin ikanayak tikit sa lilaw nga tay maulo kaya nang ito kunama na kullo makuni pinasa ako sa inis maliw tigilaw tabuas siya gobe kalaw nginata tako ikaluyas sila tano kisene awlak ti tawluti.
Jackie McKay, CBC News. Essential workers in places like the Elders Home were some of the first people vaccinated for this reason, but we're still seeing COVID get into those workers and then have to isolate. So I'm wondering how much the vaccine, I guess, is helping in this situation.
Jackie McKay, CBC, kumita makoya kanaya kalakit tutsulo inakubimi kanaya ti Siguro pango kataw yung matakapiyaw lutik suli nuwadyo anak takto kakatang at amakoy kanayak ti luani te ligya kalaksuti kanuti kita man na kaputi tamatumungay kayong nakaka.
Not everyone chose to get vaccinated, so that's how it happened.
Kikuliman ilang itay ko kapiyaw gumakatalaw ngimim matatay makapiyaw simangit tumo tay mailaki yumini.
For people who've chosen to get vaccinated, there's no doubt that the vaccine worldwide has made a big difference in their risk of severe COVID-19. So we continue to encourage everybody who's eligible to get the vaccine.
Teikko eli kapiaussima jo nalunangi tutamani nunarjoami hauinarsima matuutiqallarisima ningani teema qannimmadjoa teeli kutiqarunnani munuvadjoanarmi teemai majartuigiakkannequnga kapiauqattaquillunga.
For people who are considering calling the hotline because they may have mild symptoms, there's been some hesitancy because they know as soon as they do that, even if they test negative, they still have to isolate for 2 weeks. So are you seeing that as a deterrent for people for calling the hotline?
Tako isumasa siuqattangata yuqaalani amangami qanuiguttiqalituaruni teikkunga uqaalaviugunnartumut anitteiligiaqartitaussaqattangata tamanna anitteiligumanngimoqqailangi uqaalaqattangila.
So not everybody who calls the hotline has to isolate for 2 weeks, and especially if they've had symptoms and we can find another explanation, no exposure, we can avoid that in many cases.
Tako kikuli mauqaala yuteikunga anitteili titauqattangittuut pinasoqusiinni maqquunning kisaani qanuiguttiqatuaqqata ubbaluni katiyaqartuminiungippata tamakkua ilunati anitteiligiaqaqattangittu uqaala yuteikunga.
But we are still getting calls from people who've been symptomatic for several days, continue to work and go about daily life for as many as 5 or 6 days before they call the hotline and get tested, and have obviously risked spreading it fairly far at that point. So we'd ask everybody, if you get symptoms, stay home, call the health center on the day that you notice you've got symptoms. Call the hotline, sorry.
Kisaani suli uqaalaqattaquiyugu qanuiguttiqallituaqqata kisaani tamakkua qanuiguttiqallertuminiugala uqaalanasaaqattangata alla ulluni 5 ni 6 nut qawisartauttata innaliqqu qanuiguttiqartuminiulluti eqqanaayariaqattalertuminiulluti tamanna uluqianartumiguutaummassap saarmagutaulaqiqattarsimamma tamatkununga qanuiguttiqatuarutsi angeqqarsimat sautigilusi uqaalalusi taatsumuga uqaalavimmu.
Emma Tranter, the Canadian Press. How many inmates and staff at our correctional facilities have tested positive today?
Emma Tranter, Canadian Press kunni hatsiuleqqa anulatsiivimmiittu nuvadjuanartaarsima yullumi.
12.
You said on Friday or on Thursday that surveillance testing was going to be done. Have you determined that there's been transmission at any of the correctional facilities?
Sitamnami uqayugavi qauyisartauyuinnaulaangata nalunaersissimavita ikanisaarmapallianingani ikayortauvinni.
We don't know if there was, if COVID was brought in by one individual, and not trying to blame them, they wouldn't have known, and then it spread to everybody else. Everyone's been on isolation since the first case was detected. And so it's really going to be the next few days, the next week, that tell us if there's ongoing transmission in correctional facilities.
Qauyimangingata taana nuvadjuarna qataussuma maqquunulluni tappikunga isertaunang mga pasitsigassuang Iqaluartigu teema qauyimanningimata kisaani teema saarmapallialernergat qauyiyuqatuanga nuvadjuanartulimi taakko iluunnati anitteilititautsautigililaortu ullugalauneartuni pinasuarussernilu tamanna qauyivaallikkannilaartavu.
Justin Patterson, Tech News. Were all the elders that were transferred out tested before they left?
Justin Patterson natsiakunni taakko innai aullartitaujuinnaulaortu iluunnati qauyissartaulau qaulalaunginninginni.
Yeah, everyone was tested on Friday, which is how it was. We do weekly surveillance testing at the elders facility, and this is how the case was detected.
Teikko tallimirmi teikko kikkulima qauyissartaulortu tamakkua pinasuarusitama qauyissartauqattangata innakkuvimmiittu teema taggataana qauyiyaulaqiyuvu.
On the subject of surveillance testing, I believe 2 weeks ago when you first talked about that, you said that it was taxi drivers, the men's shelter, the elder center, the boarding home, the hospital, and correctional facilities. We've seen cases at almost all of those now in some respect. Have you expanded surveillance testing at all, and if so, how?
Taman na kik hawi sa khatam na mamakko pinasa ako sa simalakto hawi sa ikatalangan ni kayo gabi tamakko ni nga tax at tinig ang utino ang kakangit ko wimi. I can't read what I wrote. Ikayok tayo ni tamakko ilu na ti hawi sa tayo biyo katalangan liyong mata asik kaningin ni hawi sa biyo katalaki.
Yeah, we've reached out to a number of businesses or organizations that are open and offered surveillance testing to their staff either once a week or every other week, or some sort of set schedule like that. Surveillance or screening testing, whatever you want to call it, it's voluntary. We're doing it to try and catch it if it gets into that group early. And we encourage and ask everybody's cooperation with it.
Tako atu notice ma yavu na mine hati uyunu tibi uyunu lut matu nga yunu kana yakting hawi sakta hatta kun nan rakta lut pinasa ako sa mga balo pinasa ako si mako nagay mati tay ma akitaw si maluni hanga ko gayam ni nga taman na hawi sa hatam ni tak ko ni nga isa masut sa tu hawi sakta gumaguti tay ma hawi sa kay gun nakayakati ko tay ma hawi sakta hatta tilugit tay may makikulimata matumungay kayo.
Trevor at Nunavut News. You mentioned not everyone at the elders' home chose to get vaccinated. Was that elders or staff or a mix of both?
Trevor at Nunavut News kun nu hakaw gabita ko ay kikulimang yasiman ningin matakapiyaw ga inako me tay ko inna ilang yung balik kanayak tilo.
It's a personal decision for everyone, and we're not going to start it's not appropriate to start outing people in that way.
Tana isa masasiyo ko tayo katanga inus ng minuto ay makakaw sa kadyangit tugo tamak ko nga pedyo tingin.
How does the vaccination uptake compare previous to the outbreak and after it?
Tako kapiyaw ko makatalam ni nga may sunak sa ulak ka taman na nawadyo anak to kalam ni nga ni tayo mga yung mapitakalaw tinago.
It's improved. Most communities are reporting they're getting increased calls asking increasing frequency or number of calls of people asking to start the vaccine process.
Tayo mga may sunak sa ninunalin niyo kasi mayo kalabi yung katanak sa ulak na ratuti kapiyaw ko mayon.
And I can't remember what the numbers were when we started, but for Iqaluit, it's just over 50% of adults have completed 2 doses of the vaccination.
Kamang ito katsiyo yung mga tapigalaw tinagi kasi inay 50% tingi kalun ni kapiyaw sa Manilaw to.
Ken Driscoll, EPTN National News. Dr. Patterson, outside of the charges for the local bar, the chart room, has anyone else been charged for violating public health orders about COVID-19?
Ken Driscoll, EPTN ko niluta Patterson tayo ko chart room asingin ni pasiyat sa kaktukalaw sa mabasa kumitsin ng mamalitaw galin ni.
Not at this time.
Manaw yung aga.
I'm also wondering about rate of hospitalization. I'm wondering, since last week, has anyone else been flown south or admitted to Kikatani General for COVID-19 treatment?
Tako ali uni hatak to balo lak to tawga hatak to kallo na ano balo kikatani mo tema unit sa mayo kalaw ka.
No. Aga.
Jackie McKay, CBC News. Can you confirm how many people have tested positive at the men's shelter?
Jackie McKay, CBC kun ni hatsiyo ba nguti ang kahangit to kuvingan ni Novadyo anak tao sa mayo.
6.
And what is the plan for those people where they're supposed to isolate?
Kanulitay ko pang daw tao sa mavanit tayo ligaham ng ino.
Most are isolating at one of the hotels.
Ilu na tigala anit tayo titaw yo ilangan ito yo may bimi.
And the Trancher, the Canadian Press. Just to follow up on Jackie's question, can you identify which sites in the city are being used as alternative isolation sites right now?
Ama trying to Canadian Press kuni Jack you ape kutinga nalo na sigun nakina le ni tamane city mi tuyong mi vimi mangata.
Some are at the Iqaluit Hotel and some are at Frobisher Hotel.
Ilang yaksam ni tuyong mi vimi lang I Frobisher in me.
Those are the only places?
Correct.
Takutoa.
Do you have any update? We asked this question last week about Nunavut vaccinating children 12 and up. Are you looking at getting doses of the Pfizer vaccine in the territory?
Tosaktit siya tapi nasa ako siya yumi apel siya gata Nunavut sa no tako 12 ni kiuli yung atano Pfizer kaputi mi kapita kalamanga.
We're still looking into it. We don't know if or when we'll be able to access Pfizer. So I'm hoping to have an answer later this week, but it depends on a number of things.
Suli taman na hawi sak pala ya buhang atan na Pfizer atok tayo kung naksiga yung mga tamani suli kiyo yaw law nginat tataban na kay pinasa ako sa hawi laktabo.
Dustin Patterson, Tech News. Are you able to say how many people are currently isolating in both of those hotels?
Dustin Patterson at second ni hatsi batak ko to yung mi anit daily yutak ko nani.
1 sec. Thanks. There's 13 people isolating at Iqaluit Hotel and 10 at the Frobisher Inn.
13 anit daily yaksam ni mi amalo 10 Frobisher in me.
Can you provide a breakdown of where those new cases are coming from? I know that on Thursday you said that it was kind of household or like from gatherings. Where are we at with that now?
Lalo na yakong nakikita ko na kay mga nanuvadyo anak tawad le anak sa ulang mga tanuta ang kami o katigin ni ka juga bigi pinasa ako sa mikisyan nila mga nakanuilik ka.
So the majority of spread is within households. But we're still seeing gatherings. We're still seeing people visiting, like going from house to house, and we're still, there's still parties happening. So that contributes to some of the spread.
Tako kami sunas sa isa makatak to ilo mi o katigini. Suli kati katangata malo suli pula ka o katangata ilo gingita minut. Mas suli tako katit sute imigala katigi katangata pardak sute tayo mga tagasang mapalyayo suli.
Just quickly following up on that, you said 3 parties were, to the best of your knowledge, on Thursday. Has that number been increased?
Tako pingaso ni kayo ka bigi pardak tumini kawi yamini sitamang mitako kami sa ngukan na kiban.
We know of, as of late last week, I knew of 3 parties that had definitely been involved in transmission, and we hear stories of more, and there may have been one more that has put people at risk over the weekend.
Kawi mayavo tako pinasa ako si yumi pingaso tusak si mayo yavo tayo mga kati tuti mikala katigi tumini pinasa ako si yumi tusak si malang mayo ataw si kanang mi pinasa ako si nungwani tayo mga kati nga yumi ni ulok ti mikala tuti ulo kaya nak tumitit silit tilo siyak maktit sigum na nakmo.
Trevor in Nunavut News. Under what conditions could public health measures be eased in Rankin Inlet and Kinngait? Or further, I mean?
Trevor Wright, Nunavut News kung ni kanurli tayo matako na hamnang itulirin ng mamalitaw gali kasuyaw gaya kung nasinyak kaya sinang making ang nilo.
When there's less risk of introduction of COVID-19 from Iqaluit?
Ulo anak tumingin nak sa ulit kata sa mga bigo na kanino kalunay nga tumingin at yun anak me.
Has the COVID situation at the Mary River Mine changed recently, or is it still somewhat the same?
Analikya nuluya ni uyam na bingan ni kanuiling alak kanubat yun anak sa mapalaning.
So most of the staff who were positive have been transferred south over the weekend, And right now, they're in the process of transferring the remainder of staff, but a skeleton behind to keep the essential services up and running until they can get more staff in to resume operations.
Skeleton. Kami sunaksay kanayakti kalunanon at itaw sumalikti no wadyo naktas sumayot ang maluasing itako awlak titaw kanang nami ako galangi kimat taw sumanayakto tay ko ng awlat taw galin ni awlat si hulugi.
Ken Driscoll, EPTN National News. Dr. Patterson, have there been any cases in Iqaluit of people who knew they had COVID-19 actively and yet took the isolation orders?
Ken Driscoll, EPTN kuniluta Patterson, tamani kalunni nupadyo nakto kami kawi mayu make the kat ay malining ito mi kawi magalawak to ni.
I've heard accusations of it, yes.
Ito saksi mayong atay mapasagayaw yumi.
Are those accusations true?
Sulibata ko pasiyaw si mayo.
A lot of time they're impossible to 100% verify to the point where we could consider laying charges. So sorry, I'm not doing a good job of answering it. We've heard some pretty strong accusations, but without independent evidence, it's not enough to lay charges if that's what you're looking for.
Ito kuning isa ni nalo na katsa ito tema pasiyat sa ningin ni nalo na katsa sa to tema nalo na rutin ni kawi yumini lakin ningin ni to salata ila kawi gum naksilata katangin nata.
And I hate to take an extra question here, but if you could just clarify for us, I want to know, is there an active investigation into with COVID-19 ignoring isolation?
Kasi natiyar lugo tamak ko kawi sakto yo kakatamane kalunin wadyo anak to kang tuning mali nalangit tuning.
Yes, we've had a few complaints that we've turned over to review.
Makro ni tamak ko ni unnalu taw si mayo ni palisik ko no kawi.
Jackie McKay, CBC News. Follow up on Kent's question, those investigations, are they related to the parties you've been talking about?
Jackie McKay, CBC kun ni Kent apik ko ting atako kawi sa ko taw yutay ko nga pardik tuminang no nga ba?
No.
Aga.
So keep in mind that there's, again, when we're finding information and medical efforts, healthcare efforts, that we do not and cannot turn that over as evidence. It's complaints that are outside of that process that can result in charges.
Ikaw magahakti ko tamak ko to sa kataktak katiya miningin ni kawi sak pala tilutan na hamnang itulagi ko kawi sak tilugi tamak ko palisik ko no tunigun na katang itabo sa kamitsa kasi lutaw katak to sila taga pasiyat sanggok titagun nakon.
And I understand everyone's concern and anger and all of those things, but I don't wonder in the country, in the world, that's been able to use enforcement and police as its main or sole mechanism of pandemic control. It's an adjunct to the orders for people who follow measures, but it's a small part of the efforts to stop an outbreak.
Tamak ko ito kasi nakto kam nanininga naktuninga nilo tamak ko solo namito na kanata minunak so amilo tamak ko palisik ko tigo malitaw kay ni atuti lualaw sa mga mata siya mapalya ng miaulat sinang mo kasi ni tamak ko malitaw gali pidyo tigilugin malingit tunik tay mailagi yaw katsin naw ningino tay masang mapadlalat sa katak tunod. Tay malo kasi ni nukatit si gaswar ni tino sa mapala ng mitaman natok tawag nakto ilagi yawlo ni.
Thank you. The people who are isolating at alternative sites, such as the hotels, you said it's not mandatory to stay in those locations if you don't break isolation. I've heard of people checking out of those hotels. Is there follow-up to make sure they're not breaking isolation?
Tako ani teili tito yu taiko ni tuyo mi vinni tako asego behangi tuku ani ga hangi mata ubalo ani gumnak to hanga tuin na to saksi mamagwa ani yo katuin na launga.
Yeah, people who've been named as contacts or people who've been diagnosed with COVID-19 are contacted at regular intervals, and we do what we can to support and ensure they maintain the appropriate or proper isolation.
Taiko nalo na to sa mayo katiya haptu miniuning ni ubalo no wadyo anak to tas maningin ni tako kawi yak biulaw lahat tatjot ikayok daw lotilo malit sa lakalo ang mga talo anik taili ga ham na mo kawi yak daw sinato chi.
Thank you. That wasn't exactly my question. My question is, when people leave the hotel, when they self-check out before that isolation is over, are you following up to make sure they're going to a place where they're still isolating?
Tanapit ko tinga tama ka view taiko ani yumini to yung mi vimmi pijakilaw nati kawi yak daw hatta kamalit sa kalo ang mga tanit taili ga ham na mo.
So yes, if people are under named as a contact or have been diagnosed with COVID-19, they're contacted every day or 2 or 3, depending upon the circumstances. So when somebody leaves, when they're in the hotel or when they leave the hotel, that contact continues, and one of the questions people ask is, are they still isolating? Where are they? Those kinds of things.
Tako ani teili tito yu katiyaw yu mini ubalo no badyo anak to akto mini ulo tama ubalo ulo makupi nga sulo ni nagay matakaw yu giyak to katak to sulo to yu mi vimi ani yu hakto mini ugalo akat ay makaw yu giyak to katak to katiyaw hak ningi kalo ang mga tambalo ani teili kalo ang mga tasuli.
I'm a transfer to the Canadian Press. To follow up on Jackie's question, when public health phones somebody and they aren't isolating and they're meant to be, what steps do you take?
I'm a transfer Canadian Press community ko kalabi yung hatak to ani teili tito yu tayo malinalan ningi pata kanoiliga katak kasi.
The first thing is to find out why. Oftentimes it's because they had an essential need that could not be met with their circumstances, and then try to hook them up with supports or alternative ways to get those needs met, and then deliver warnings in various ways to ensure that they understand that they not only are expected, but it's mandatory that they isolate.
Sibula pa mi apiri khatak tabu summan tay manalagun ni tumini mga ta tay mailo nagalangin ni tay mapijaka khalakitangin ni ay tsira nira khatak tu tay ma atu ina vigila khatak tabu ikayu tagun naktu ni khanok tamak kuninga pikhatak ng mga ta pigya khalakitangin ni inaptok tayo gas takot tay ma tukisiumat sa akulugi tay ma niriugiyaw mata ila niriugiyaw tu inang ito kisani asago bekang ito ko ani tayo laki kaya takalawang ta.
I'm wondering what efforts were made to keep the Elders Center open. Why couldn't extra staff be brought in? Were nurses unavailable?
Ano at so takalawang mga sita na matuwing akan nakaswak tayo kuluguin na kubig sumali asikan ng inikanayak ti sa siulawang inla siyo baloan na siyo tiniyatuin nakakalawang iman.
There just aren't enough nurses to meet all of the potential needs right now, and so when we lose not only nurses but other staff to something like this, there's in most communities in Nunavut, there's not a large pool to draw from on short notice.
Tako ami kaksituin na news na lang ngataan na siyo tinig suluan na siyo tinig asing inilunik kanayak tinig atuin na yung hakun na tilugo no badyo na pilugo tayo mayong naksakatang nga tambalo kaya ubektis sa gayak to namin sunin nunalin ni pitakakatangin man.
Doesn't Patterson News? Are you able to provide an update on the variant testing?
Tästä pitää nyt se kun niitä kuoli ja haui sakta hattaktu asitsi pallia jo munuvat jo namu hanu.
We haven't gotten any new results since last week. Basically, everyone that's been, every result that we've gotten back in Iqaluit has been the B117 variant, and all but one of the results from the Baffinland mine were the B1.617.2 variant.
Tako nyt ääni haui sakutiminen ni pinasaurus ulottuminen pidämitty kisani tako analuna tausima yuilun natihalun ni B117 novat jo nausima kisani ta natausito Mary River minulu yani B1617 ta natausito simayo.
Able to provide an update on contact tracing? How many unlinked contacts are there currently, and how many contacts per case are we seeing now?
Tako ali kia katiya hatta tapesukta hatta tillugi hatsi hatta kayulikhan.
There's 4 cases right now that we don't have links.
Mana yo sita nuvat jo nakta simayo nakingas mga takaw yo smangito.
And for the average number of non-household contacts is down to 1 or 2, I believe, at this point.
Tako ali da katiya hatta to ilumi hatiging itamino katisi yumino hatta to ataw sumi makko niluni.
Trevor, Nunavut News. Are there people you are unable to reach out to for contact tracing during this outbreak, I guess? Or?
Trevor Wright, Nunavut News, kunita ko tik hawi katagun nasa hatang ilangi katiya miniu yu ni hinirtilo si ilangi nanigun na hatang ilasiyo.
Yeah, that's when we go out with a public announcement, and we've done that a few times. If you're at certain locations, call us and get tested, or if you've been to parties, call us and get tested. Those are times when we don't know everybody who was there.
Daima kikkutuin anno tusaktit sisihattartugu daima hawi gunnangigaigatta kikkute kanittumini mga takatiyuminerne uppalo imiqalahatigittunni daima hawi matinnata hawi manahattangin makikku tekanina mga daima ukala khuyi sisihattartugu hawi saktagu makhuyiluta.
Since the last outbreak or this outbreak, have you guys been able to find enough house staff or nurses to, I guess, physically be there to help out?
Kinulla paamitaman sama pallela umningani taiko anama haptak ana hanang itulirina wikana yakti ubalo ana siyokti kayo kunnaktui.
Do you mean in the outbreak response?
Yeah. Have you guys been able to find enough physical staff for outbreak response efforts?
Sama pallela yuno kamayini na makatak ikana yaktisi.
Yes, we've shifted some staff from QGH nurses and others to help out, and that's made a significant difference. We've also increased the staff who are answering calls on the hotline, and the number of public health nurses providing remote or virtual support.
Tako nutausima yu ilangi hikiptani ana bealumi ana siukti ikayok simana halakitu tako ana siukti ikayok alarmingit amalo ikana yakti ami sunik saulaktu taikani ukalabi uhattaktumi iki uhattaktut amalo tako ana siukti tamani ikayok tununalini ami sunik sauninginut akaunalaksimayo.
Ken Driscoll, EPTN National News. Just to go back to my earlier questions, Dr. Patterson, I'm wondering how many cases are being investigated right now in Iqaluit of people who knew they had COVID-19 and still ignored the isolation orders? Is it just the one, or are there more?
Ken Driscoll, EPTN kunapikutigi kawyang hatsu mga takawi sakto yu ikalun ninuvadyo naktutaksimayo nalan ningitu yataw situ balasik kan haka.
There's one case where there may be enough evidence to or there is enough evidence to continue the investigation. There have been a few others where that I'm aware of that complaints have been made, but there's not enough evidence, and I honestly don't know the exact number. And there may have been others that people contacted the RCMP or others directly.
Nataw si manalo na ko tikat sa ato tayo masuli ko saktaw balagun nak siniato video tikat sa ato ti pasiya sa ko titagun nak ningani asiliw galo kasi anita ko sakiro tininalo na ko tinipitahang ilo ang ata ilang ilo kay palisik kuno ukala katak to ka to nak tutita magko kaya katang itabo ilang.
Dr. Patterson, were you getting phone calls about people ignoring their isolation while COVID positive when there were outbreaks in Rankin Inlet, Arviat, and Savikataaq, or is this an Iqaluit phenomenon?
Dr. Patterson, okala vio hatta yung visita ko anit daily yali na lang ito minuning ini kanyang sinang may akvya ni sanikilo ang milo balute ma tamane kalum nito na lang ila.
It's a human phenomena. I think every jurisdiction that's dealt with outbreaks has dealt with this as well.
Ni ino nitid no taman na namito na no nagjo mi tay may gunang atay may simabugut tamani.
Jackie McKay, CBC News. Earlier you said part of the reason the staff had to isolate at the elders' home was because not everyone got vaccinated. Are you able to confirm that the positive case was a person who wasn't vaccinated?
Jackie McKay, CBC kung no hakaw gabitan ay lagi yaw nakaksugot ay kuya kanayak tingi kapayaw si mangi tuinaw ningin no. Tanan naluna taw si mayo kapayaw si manaka.
To be honest, I don't know that individual's vaccination status off at all.
Kaya mangit sa ta kapayaw ng mga kapayaw si man ng mga kapayaw si man ningin mga alumni.
Just to follow up on that, are you able to clarify then how people not getting vaccinated played into everyone having to isolate?
Can you say that again?
How if so not all the staff were vaccinated and that's what led to everyone needing to isolate at the elders' home?
Tay ko agui kanayak tilimang kapayaw si mang ning laungin mata tay may mailo nati nalunam ni kung ano aniteli kaya kalakan.
I'm not sure what you mean. I'll just back up and review the event. So one individual everybody was swabbed on Friday, staff and certainly all residents and most staff. One staff who had been working regularly was found to be positive, had COVID-19 and may have exposed the majority of staff. So right now, regardless of vaccination status, if you've been exposed in close contact with COVID-19, we get everybody to isolate for 14 days from the last exposure, and that resulted in the majority of staff at the Elder Center being in isolation. And that created the circumstances that we found ourselves in Saturday morning.
Kano kaya peksugalo at tutikisi anita na naluna yang nakta ngata na tausir ilu nating ila ko isak taw lilo to talimang me tay kani inna limat amalu kanayak ti langit tana taw silang kanayak ti kanaya na tatto hoy yaw talik kuno badyo anak to hapto minuningan ni kambalo naluna kun neksuni sa maksituin na kaya hapto minuningan ni asingin ni kanaya katingin no. Kapayaw si man ni kalwa kata kapayaw si magalwa katalo dako kapayaw ila katiyaw yung mini ulo ni 14 ni aniteli ga kasi chaw tigi katakto dako alo kanayak ti aniteli titaw ga halaw nga tayo na ti indak ko vimi tayo matuyaw ga kalilaw ko taman nakamagigya kalilaw kati kunatsi mo yalak na ulangan ni.
Thank you. This next question might be best suited for the health minister, but I can let you guys decide. At the Frobisher Inn, the clients from the low barrier shelter were moved there because the Iqaluit said that they were high needs, and so that facility is currently run by GN staff. Are you planning on continuing to run that facility at the Frobisher Inn, or is that going to end once all the low barrier clients are out of isolation there?
Kako Frobisher nutaw ng ngata ang kahangit to kubim mo hatak tuit ako alo Gavamakkunni qanayarteqarsutiarsarniimi sulitaimailuungin naqatalangavatai na frobissurin takkua angeqahangittukuvimmiu taikanigun niqaluaqqatassuli matuingalaqa.
It depends on the circumstances. There are other individuals outside of people from the low barrier shelter who are in need of other supports, and that may be more appropriate for the Frobisher instead of the Iqaluit. So maybe, depends on where we are in a couple of weeks.
Tana sulinalunaqtu qanui gayarninganni kisani tamakkuassingit angeqahangittukuvimmiingaartu taikangortautuinnahattariaqalaartu atuinnau giaqatuinnarealissulinalunaqtu kisani maanna.
I'm going to turn to the Canadian press. Where are we at in terms of capacity? We have outbreaks in several facilities right now. We have staff from the GN now supporting the shelter. Do we need help?
I'm trying to Canadian press kunni khano lepiyum namna hattigit seaqitamaan no yaseama pallia yo hattillugu namituinna taikkoilu iqana yaqtingin gavamak kunni aulat silirtu tangiqqahangittukku pimmit ikayoqtau kannera haqqita.
Last I heard, our staffing at this point is stable and hasn't changed from last week.
Tusarsimayakkumaanna musuqqat simangittu taikko iqana yaqtingin aamat sealirtu pinasuaqussuuyumi tusayuyakkatayama.
I'm going to ask a broad question here, but what is your biggest concern about the outbreak in Iqaluit right now? What's the most pressing issue for you?
Maanayo kisuvai sumaalugi naqpaaqaye tamaani iqalunni saama palliani pillugu.
Stopping the spread to new households, new facilities, and workplaces as soon as possible.
Nuqaptitauga hamninga tamanna saama palliani asinginnu illumiu hatinu asinginnullu pili review yun tamanna nuqaptitauga khatsautiginiga tamad isamaalunnaarneqpaangu.
Dustin Matardan, Tech News. Following up on Jackie's questions, I guess simply put, have we seen any cases of vaccine failure?
Dustin Matardan at Sakunni Jackie piqqutinga pillugu taakua nuvat ila kaputi yatuutiqarsimanginninga qauyissimivi.
Yes, we're aware of 5 as of yesterday. So those are 5 individuals who are fully vaccinated and got COVID-19. I think all of them or most of them are asymptomatic, meaning they have no symptoms. And that's consistent with the data from around the world. If it was randomly distributed, we've had 160 infections, 30. I'll let you interpret. I'll explain in a second. I'll do the math to show that it's quite good.
Okay. Qauyimaya haqtunga taakkuninga tallimani taima tamakkiinni kapiyaussimaгаluartillugi nuvatjuanaqtaarsimayuni taakko ikkisani iluunnati qanuigutiqangittui taimaatsaina taimaiqattarsimayu nunarjualimaami.
Anyway, 130 some adults have been infected. If it was randomly distributed, we'd expect, like where half of adults have been vaccinated, we'd expect there to be 65 infections amongst people who are fully vaccinated. The fact that only 5 has occurred indicates that the vaccine is effective and is consistent with all of the data coming out around the vaccine about how effective it is at eliminating infection.
Sulu 130 uniqata inna nuvatjuanaqtaarsimayun taakko nalunataussimalutik taakko abbangit kapiyaminiussimaluti tamakkiinni 65 ngugayaqtu nuvatjuanaqtaaqayaqtu kisani taakko qanimmatjuaruti qarayangittuugalua kisani limaanna yullumi umutallimatuinna mata maani nuvatjuanaqtaarsimayu kapiyaussimayu tamanna tukisinaqtu taakko kapiyaussimanam matuutiqaqattarningani tamanna qanimma luatteiliguutiugunnarningani kapiyaussimayunu.
With the recoveries in Rankin and Kinngait, what's your takeaway from the success of those in terms of containment?
Tako hanui kun nero te halasimaninga no kangasina mi kingarnelo hanutigi tamanna kayusitsaarnaqa qutiqarsima basaarmarteilititsina.
So there's two lessons. Number one, contact tracing works. It was through the efforts of the staff at Iqaluit Public Health that we identified those individuals before the plane had even landed, and were able to get them into isolation right away and prevent introduction.
Tako makuni ligutigisima yavun tanna sivulliqpa ta makate yayuminerne khawi sakattarneq atuutiqatsiaqunartoq taakko iqanayartingi qalunni ukumainni arbingani nalunaersilaunga tataana taakko qangata yumilaurtinnagilluuni taikunganunaliinnu taakko alu anittailititautsautigilaungati.
The second lesson is the importance of calling early as soon as people get symptoms. The individuals in Kinngait called within 24 hours of developing symptoms and stayed home until they were tested and got the results back. And that allowed us to keep it from spreading keep it from spreading within the community of Kinngait. So yeah, contact tracing works, and we really encourage people to call as soon as they get symptoms.
Tanna tulle apimmario uqalatsautige khattarea harne qanuigutiqat lituaqata taikkuali kingarni 24 iqaqaitungaani uqalatsautige yumini ummati taima qanuiguti qalerneqarsutik qawisartaulaunginninginni ammalu naluneertaulaunginninginni tamanna searmarteiligutiunniqatsiarsima yukingarni tamannalu katiyaminuuyuni qawisaqattarni atuutiqarunnatsaartoq taimaima tau uqaujigiaqunga qanuiguti qalituarutsi uqaalaqattarlussi uqaalaviugunnartuni.
Thank you.